At the end of this topic, you will be able to tell the importance of adolescents' health, reason out the important healthy food to be consumed during adolescence, list out the personal hygiene practices to keep the health fit, point out the problems faced during adolescence, identify the sexual abuses and its effects, predict the outcome ill effects of drugs, compile the various effects of cigarette smoking, relate the cancer and various other diseases with smoking, and try avoiding during adolescence. Adolescent children need special attention towards diet, exercise, and personal hygiene, especially with female and male reproductive health. The basic thing to be followed by both male and female during adolescent period is the following. Take bath at least once a day, paying special attention to underarms, groins, and genitals. Change the underwear daily. The underclothes should be made of cotton. Menstruation in females is a natural cyclic process like other physiological activities like breathing, drinking, etc. Girls should neither be worried nor be ashamed of menstrual flow. Sanitary napkins or a pad made of clean soft cloth should be used to absorb menstrual flow. Sanitary napkins or cloth should be changed frequently depending upon the menstrual flow. If a cloth is being used repeatedly, it should be cleansed with soap and hot water and dried in sunlight for use. Genitals should be washed with soap and water before using a fresh napkin. The adolescents need more calories and other nutrients due to spurt in growth and increase in physical activity. The nutritional deficiencies during this period affect physical growth, intellectual development, and sexual maturation. The diet of adolescents should meet the demands of physical and intellectual growth, provide adequate reserves for illness, pregnancy, and prevent adult onset of diseases related to nutrition. Example, hypertension and osteoporosis. Hygienic balanced diet should be taken to avoid complexities. Proteins and carbohydrates are necessary and most during the adolescent period. Apart from these, there are some important foods discussed under minerals. Minerals increases skeletal mass and blood volume as the body needs calcium, phosphorus and iron. Calcium intake is must to prevent osteoporosis in later life. It is present in milk and milk products. Iodine. It helps to prevent thyroid gland-related diseases. Iron. Lack of iron in the diet results in anemia. In boys, iron deficiency occurs due to muscle spurt. In girls, menstrual flow and muscle spurt causes severe anemia if it is not compensated with proper iron content food. Green leafy vegetables, jaggery, whole pulses are rich sources of iron. Avoid junk food and stick onto a healthy food diet. Especially the foods like sprouts, fruits, vegetables are unbeatably healthy during adolescence. Sprouts are natural living enzyme-rich, low-calorie, pre-digested foods. They have double the amount of vitamin A and 5 to 10 times higher amount of vitamin B and vitamin C. They have easily digestible simple sugars and simple molecules of protein, which is the source of all enzymes. They contain significant amounts of calcium, iron, and zinc. There is a recommendation from nutritionists that taking soaked nuts, legumes, and grains give essential component for our livelihood. Most seeds sprout easily, as do many legumes. Nuts take quite a long time to sprout. Best sprouting is seen in sunflower seeds and mung beans. Mung beans make an excellent sprout and used widely in cooking. Soya and kidney bean sprouts are toxic and better to be avoided. Steps to make bean sprout at home. Pick out the best ones and remove the damaged pieces. Soak them in clean water overnight or for about 12 hours. Drain, rinse and place them in a wide-mouthed bottle and provide place for them to sprout. Cover the jar with a cotton cloth. Keep it in the dark area to avoid the sunlight as it makes them to taste bitter. As soon as it germinates, all the starches, oils, and other nutrients present in it begin to turn into vitamins, enzymes, proteins, minerals, and sugars. The vitamin C content of the bean increases when it starts sprouting. Rinse the bean sprouts 2 to 4 times a day, and they turn to be pale green, fresh, and ready for eating in 2 to 6 days. Personal hygiene is a clear indicator of man's personality, and it should start from the hair up and end down at the toes tip. There are some tips to maintain personal hygiene as follows. Take bath daily. Always wash your hands before and after meals. Keep fingernails clean and avoid nail polishes and jewelries. Wash your teeth and mouth before and after each meal. Avoid touching the face, nose or mouth while cooking food. Avoid coughing or sneezing around food. Taste the food with a clean spoon. Change clothes, especially undergarments, every day. Do not defecate in open field and use clean toilets for defecation. Visit a doctor in case of sickness and do not take medicines on your own. Sexual abuse is the most common abuse during teenage, but it can be prevented as well as you can be protective of your own. Some substances like alcohol, drug and cigarette are attractive when you are a teen and you may fall for it and may get addiction too. Taking steps to prevent childhood sexual abuse is an ongoing parental responsibility. In 80% of cases, the abuser is someone the child knows, a trusted or loved adult or older child. Known persons use threats, bribery, or tricks to take advantage of the child's innocence. There are 3 stages in the prevention of sexual abuse. They are primary prevention, secondary prevention, tertiary prevention. Primary prevention. Preventing the abuse always stands first, as prevention is better than cure. Avoid being alone in a company of suspected person. Avoid wearing provocative dresses. Never allow anyone to hug, pet, or kiss you. Take care of the way you sit, as a sitting posture should not induce others. When you travel by auto, bus, or by train, keep distance from the other sex. Secondary prevention. Secondary prevention includes the early detection and reporting of perpetrators for the purpose of stopping the tertiary prevention. Tertiary prevention comes as a treatment for the child who is sexually abused. Tertiary prevention helps the abused children to get rid of their mental agony, social fear, social stigma, etc., and develop their self-confidence and self-approval. Secondary prevention. Secondary prevention includes the early detection and reporting of perpetrators for the purpose of stopping the harassment. Secondary prevention minimizes the negative effect and develops a positive feeling on the child. Tertiary prevention. Tertiary prevention comes as children who have been sexually abused often show the following signs: a sudden dramatic change in behavior or personality, recurring nightmares, regression to early behavior patterns such as bedwetting, withdrawal from friends and family members, imitating adult sexual behavior, expresses hostile aggressive behavior. Alcohol is the most abused substance among teenagers. Consumption of alcohol leads to frequent memory loss and hepatitis, liver damage. Drug, in French called drogue, carrying a meaning of a dry herb. Drug is a chemical which is taken for some illness and is withdrawn when the desired effect is achieved. Illegal drugs are used against law for recreation. Drugs are extremely dangerous because they slowly change the behavior of the users and reduce the functioning of heart and nervous system. The side effects of the drug addiction are serious, which ruin people's lives, cause very unpleasant death. Opium, heroin, marijuana, and cocaine are some of the illegal drugs. Some of the behavioral changes of drug addicts are as follows: rejecting old friends and acquiring new ones, lack of interest in hobbies and extracurricular activities, staying away from home even after school hours, drop in grades and disinterest in schoolwork, less botheration of personal appearance, often fall into mood swings or getting irritated quickly. So please avoid drugs and say a big no to it in case the temptation arises. Children should avoid the company of drug addicts. Advertisements of drugs on public media should be banned. Doctors' advice and prescriptions should be strictly followed. Cigarette smoking is one of the greatest health hazards of the 20th century. It is now widely regarded as the chief preventable cause of death. Tobacco products such as cigarettes, cigars, smokeless tobacco like snuff, and chewing tobacco are more dangerous. When a cigarette is burned, it is broken down into its chemical elements from which lethal chemical compounds are created. The chemicals like nicotine, ammonia, acetone, formaldehyde, hydrogen cyanide, and some 4,000 other chemical constituents are released between 2 puffs. All these chemicals act as an irritant, mutagen, poison, and release more than 40 types of carcinogens. Smoking causes serious health problems like raising bad cholesterol, which medically called as low-density lipid, and decreasing good cholesterol, that is high-density lipid. Blood vessels are damaged and constricted, so the blood flow is disturbed, sticky with the walls, forms clots, and raises the risk of heart attack or stroke. 80% of cancerous deaths are linked to smoking. Smoking aggravates asthma, bronchitis, pneumonia, and emphysema. Smoking is the main cause for peptic ulcers and cataracts. Cigarette increases the risk of infertility in both men and women. Children of smokers are prone to asthma and ear infections. Say no to smoking and live a healthy life.
In this topic, you have learnt
adolescents need special attention towards diet, exercise, and personal hygiene. The basic thing they should do is to take care of underarms, groins, and genitals, and menstrual hygiene. The adolescents' food includes more proteins, carbohydrates, and minerals, as their muscles spurt and losing more energy during menstruation in case of girls. Sprouts are recommended for all ages as it is enzyme-rich, low-calorie, pre-digested food with high vitamin A, B, C, calcium, iron, and zinc. Sprouts can be made easily at home where mung and sunflower make good sprouts, but soya and kidney bean are toxic. Sexual abuses, cigarette smoking, drug and alcoholic intake are the common practices in adolescence, but it can be prevented and avoided. There are 3 stages in prevention.
At the end of the topic, you will be able to list down the types of cancers with examples, discuss the carcinogenic agents, explain the treatments for cancer. A cell is the basic unit block of all living things. During their lifetime, body cells are frequently reproduced and replaced by processes called mitosis or meiosis, depending on the types of cells. As the cells age, cell division slows down or may completely stop. Many of these cells divide only when the existing cells are injured. Cell division is a highly controlled process. But sometimes, due to certain known or unknown factors, these cells may exhibit uncontrolled cell division. They start multiplying very rapidly and begin to invade and destroy neighboring normal tissues. This abnormal condition is called cancer or malignancy. These abnormally growing cells clump together and form a mass called tumor, except of course in the case of blood cancer. When this growth exhibits characteristics of cancer, invasion, it is called a malignant growth or a malignant tumor. However, not all tumors are malignant. The non-cancerous or non-malignant tumors enclosed in a layer of connective tissue are called benign tumors. They do not grow rapidly like malignant tumors, and they do not invade the neighboring tissues.
cancerous cells disturb the normal metabolism and invade to the other areas through bloodstreams, causing secondary tumors. This stage is called metastasis.
How do cancer cells differ from normal cells? Characteristics of normal cells. They reproduce daughter cells with exactly the same characteristics. They stay localized in exactly the same place. Once damaged, they die or commit suicide. This is called apoptosis. They stop reproducing at the programmed time. They are function-oriented. They show normal chromosome number. They have built-in blood vessel systems. Each cell has a single nucleus. Characteristics of cancer cells. They never stop reproducing. Cell division is not regulated. They do not stay localized in one place. They are primitive, that is, they do not perform any cell function except that of multiplying. They show abnormal chromosome number. They do not have built-in blood vessel systems. Each cell has multiple nucleus. Cancer can affect any tissue in the body at any stage. If cancer affects the epithelial cells that cover the body organs, then it is called carcinoma. Cancer of the lung, breast, pancreas, and stomach are examples for carcinoma. If cancer affects tissues like muscle and lymph nodes, then it is called sarcoma. Cancer affecting blood cells, especially of white blood cells, is called leukemia.
Lymphomas are cancers that begin in the lymph nodes and immune system tissues. Adenomas are cancers that arise in the thyroid, the pituitary gland, the adrenal gland, and other glandular tissues.
Agents that cause cancer are called carcinogenic agents. There are 3 types of agents that cause cancer. They are physical, chemical, and biological agents. The following are some examples of carcinogenic agents. Physical carcinogenic agents are ionizing radiations such as ultraviolet light, X-rays, radiations emitted by radioactive materials. Chemical carcinogenic agents are tobacco, coal, tar, aflatoxin, asbestos, cement, pesticides such as dichlorodiphenyl trichloroethane, food additives, dyes, some of the drugs, chemicals in automobile exhaust, alcohol. Biological carcinogenic agents are some viruses. Tobacco smoking and gutka chewing. It is a great social health problem being addicted to tobacco smoking and gutka chewing. These are reasons for major social health problems. Alkaloid nicotine present in the tobacco gives a kind of instant energy but gradually weakens the body. Consequences of tobacco addictions: affects the central nervous system, causes heart diseases, mental retardation, psychological depression, feelings of insecurity, paralysis, and acute neuritis. Causes lung cancer, oral cancer, gastrointestinal tract cancer, and so on. Pregnant women may give birth to mentally retarded, low birth weight babies with deformities. It is therefore necessary to educate young citizens and also enlighten users about the bad effects of tobacco consumption. Early symptoms: cough lasting for more than 2 weeks, a persistent change in bowel habits, unexplained loss of weight and appetite, sudden growth of a mole or wart, a hard lump in the breast, excessive loss of blood, persistent sore throat and hoarseness in voice. Preventive measures: refraining from smoking, using tobacco products, consuming alcohol. Proper diet and regular physical exercise can prevent the occurrence of cancer to some extent.
In this topic, you have learned
Metastasis is the stage where the cancerous cells disturbs the normal metabolism and invade to the other areas through blood streams, causing secondary tumors. Carcinomas are characterized by cells that cover internal and external parts of the bodies such as lung, breast, and colon cancer. Sarcomas are characterized by cells that are located in bone, cartilage, fat, connective tissue, muscle, and other supportive tissues. Lymphomas are cancers that begin in the lymph nodes and immune system tissues. Leukemia is cancers that begin in the bone marrow and often accumulate in the bloodstream. Adenomas are cancers that arise in the thyroid, the pituitary gland, the adrenal gland, and other glandular tissues. Treatment of cancer involves surgery, chemotherapy, radiotherapy, and hormonal therapy.